Do gloves fully protect your hands? Whatever you choose for gloves, whatever type, do they truly work on your hands? And the answer would be probably not. They don't fully protect your hands. Now, even Centers for Disease Control states in the CDC guidelines that even sterile surgeon's gloves have a leakage rate of between 6 to 16%. So if you are wearing gloves, after a period of time, you might find that there are microperforations and pinholes that can occur. This depends on the type of procedure and the duration of wearing the gloves. The variance was whether, it didn't matter whether it was nitrile gloves, vinyl gloves, or latex gloves. They all seem to leak at about the same rate. The Food and Drug Administration, who actually governs the medical devices known as medical exam gloves, allows us to have a 2% leakage rate in a box of 100 gloves. So for every 100 gloves tested, 2 are allowed to be defective. And this is the way that they test for defects. They take gloves. One method is to fill the glove up with 1,000 milliliters of water, suspend it, and then look for leaks. And so if a box of 100 gloves is opened in your office, who gets the bad glove? Do you get it? Do you get it? What if you get both of them? And then you possibly have gloves that have microperforations or pinholes. And when you remove your gloves, you know, sometimes there's a little perspiration underneath your hands. That may not all be you. That might be some of the patient's oral microorganisms that have wicked in through the microperforations or pinholes that may have occurred on your gloves. It's important that we wash hands not only before we put gloves on, and in some states, dental boards require that we wash our hands after we remove our gloves as well. Before we go on to the next point of infection control image, I need 3 volunteers to help me out with a demonstration and exercise to show how gloves work. Could I have, and you'll win prizes. Did I mention you'll get something out of it? Come on up. And let's see, there's 1, there's 2. From the same office, there's 3. Come right up. And what we're going to do is we're going to take your size glove. What size gloves do you wear? Small. Okay, so you're small. You can open up this package of gloves, never used on a person before. I don't know if you have the defective glove or not. And what size glove do you wear? Small also, okay. Here we go. Just rip open the package, and you are medium, okay. And you can rip open the package here. Don your gloves the way that you would normally don them during patient care. By the way, these ladies look so nice in their sweaters that have their office brand embroidered on the front. I just think that is awesome. And you know, it looks so organized. Beautiful. Okay, so bring your gloved hands on over here. Okay. Once you wear your gloves, make sure there's no holes. And this is something that we should be doing when we don our gloves always. Besides the 2% gloves that are already defective, we should be checking for tears and holes. Now, once you've got your gloves on, the challenge I give you is I'm going to put a little bit of shaving cream in the palm of your glove. And I'd like you to rub it in just like it was hand cream. Then I'm going to ask you to remove your gloves without getting any of the shaving cream on yourself, on me, on the floor, or on anybody else. So here we go. Oops, you know what? You got way too much. Can you share part of that with her? Thank you. About half. Here we go. I apologize. It got pressurized on the airplane. And then rub it in just like it was hand cream, tops of your gloves, bottoms of your gloves, in between your fingers. Okay. Now, contestant number 1. This is Jennifer. Would you kindly remove your gloves one at a time without getting any of the shaving cream on yourself? Or me. And let's see, did you get any shaving cream on yourself? A little bit. Okay, hold tight. Contestant number 2. What's your name?
Debbie.
Debbie. Now, the shaving cream is a little bit slippery. That's on purpose. But think of it as blood, body fluid, saliva from your patient. Got a little bit hung up on the watch. Okay. And let's see, how did you do? She did very well. She didn't get any. Wait, right here. Now we have one more contestant. This is Brenda. Oh, she's feeling the pressure, yes. And by the way, she had her glove tucked over her shirt, so conveying that would be the way that she'd do it over her clinical jacket. Now, is this the way that we take off our gloves in real life? We are in a hurry and we rip them puppies off. And so let's see, you got a little bit on me, a little bit on the floor. Any on your skin? No, none on your skin. Don't worry about that. It's just shaving cream. It'll be fine. So the point being is that 1 out of 3 tries, you were able to get the gloves off without getting anything from the outside of the glove on you. But you were paying attention. You weren't talking to your patient who you were getting ready to dismiss or escort to the front desk. You didn't have any other pressure on your mind other than removing the glove. And so when we're in our typical work day, imagine that what's on the outside of the glove has a real good opportunity to get on your skin, on your clothing, on the floor, on surfaces, and now you've got what's called fomites. Fomites are areas of surfaces that we can cause cross-contamination to occur. Okay, now let's see. So Debbie did the best job here. I'm going to give you an opportunity to pick. You can get one of our books here, OSHA training records book, or you can get hand cream. Hand cream to protect your hands. And these ladies who managed to get a little bit on the floor get first aid kits.
Thank you.
And thank you very much for being part of the demonstration.